Assalamualaikum warahmatullahi wabarakatuh. My name is Tasa Mutia Wulandari. My number BP is 1701027. In my part, I will explain the material about quinolone antibiotic. Quinolone antibiotic. A quinolone antibiotic is a member of a large group of broad-spectrum bactericidals that share a bicyclic core structure related to the substance for quinolone. They are used in human and veterinary medicine to treat bacterial infection, as well as in animal husbandry. Nearly all quinolone antibiotics in use are fluoroquinolones, which contain a fluorine atom in their chemical structure and are effective against both gram-negative and gram-positive bacteria. One example is ciprofloxacin, one of the most widely used antibiotics worldwide. Medical use. Fluoroquinolones are often used for genitourinary infection and are widely used in the treatment of hospital-acquired infection associated with urinary catheters. In community-acquired infection, they are recommended only when risk factors for multi-drug resistance are present or after other antibiotic regimens have failed. However, for serious acute cases of pyelonephritis or bacterial prostatitis, where the person may need to be hospitalized, fluoroquinolones are recommended as first-line therapy. Due to people with sickle cell disease being at increased risk for developing osteomyelitis from the salmonella, fluoroquinolones are the drugs of choice due to their ability to enter bone tissue without treating it, as tetracycline are known to do. Fluoroquinolones are featured prominently in guidelines for the treatment of hospital-acquired pneumonia. Children. In most countries, fluoroquinolones are approved for use in children only under narrowly defined circumstances, owing in part to the observation of high rates of musculoskeletal adverse events in fluoroquinolone-treated juvenile animals. In the UK, the prescribing indication for fluoroquinolones for children are severely restricted. Only inhaled anthrax and pseudomonal infection and cystic fibrosis infection are licensed indication in the UK due to ongoing safety concerns. In a study comparing the safety and efficacy of levofloxacin to that of azithromycin and ceftriaxone in 712 children with community-acquired pneumonia, serious adverse events were experienced by 6% of those treated with levofloxacin, and 4 of those treated with comparator antibiotics. Most of these were considered by treating physicians to be unrelated or doubtfully related to the study drug. 2 deaths were observed in the levofloxacin group, neither of which was thought to be treatment-related. Spontaneous reports to the US FDA Adverse Effect Reporting System at the time of the 20 September 2011 US FDA Pediatric Drugs Advisory Committee include musculoskeletal events 39, including 5 cases of tendon rupture, and central nervous system event 19, including 5 cases of seizures, as the most common spontaneous reports between April 2005 and March 2008. An estimated 130,000 pediatric prescriptions for levofloxacin were filed on behalf of 112,000 pediatric patients during that period. Meta-analysis conclude that fluoroquinolones pose little or no additional risk to children compared to other antibiotics classes. Fluoroquinolones used in children may be appropriate when the infection is caused by multidrug-resistant bacteria or when alternative treatment options require parenteral administration and oral therapy is preferred. First effect. While typical drug side effect reactions are mild to moderate, sometimes serious adverse effects occur. Box warnings. In 2008, the US FDA added black box warnings on all fluoroquinolones, advising of the increased risk of tendon damage. In 2016, the FDA found that systemic use by mouth or injection of fluoroquinolones was associated with disabling and potentially permanent serious side effects involving the tendons, muscle, joints, nerves, and central nervous system, concluding that these side effects generally outweigh the benefit for people with acute sinusitis, acute bronchitis, and uncomplicated urinary tract infection when other treatment options are available. Concerns regarding low blood sugar and mental health problems were added in 2018. Tendons. Quinolones are associated with a small risk of tendonitis and tendon rupture. A 2013 review found the incidence of tendon injury among those taking fluoroquinolones to be between 0,08 and 0,20%. The risk appears to be higher among people older than 60 and those also taking corticosteroids. The risk also may be higher among people who are male, have a pre-existing joint or tendon issue, have kidney disease, or are highly active. Some experts have advised avoidance of fluoroquinolones in athletes. If tendonitis occurs, it generally appears within 1 month, and the most common tendon injury appears to be the Achilles tendon. The cause is not well understood. Nervous system. Nervous system effects include insomnia, restlessness, and rarely seizure, convulsion, and psychosis. Other rare and serious adverse events have been observed with varying degrees of evidence for caution. Aortic dissection. Fluoroquinolones can increase the rate of rare but serious ruptures in the aorta by 31% compared to other antibiotics. People at increased risk include those with aortic aneurysm, hypertension, certain genetic conditions such as Marfan syndrome and Ehlers-Danlos syndrome, and the elderly. For these people, fluoroquinolones should be used only when no other treatment options are available. Colitis. Clostridium difficile colitis may occur in connection with the use of any bacterial drug, especially those with a broad spectrum of activity such as clindamycin, cephalosporin, and fluoroquinolones. Fluoroquinolone treatment is associated with risk that is similar to or less than associated with broad-spectrum cephalosporin. Fluoroquinolone administration may be associated with the acquisition and outgrowth of a particularly virulent Clostridium strain. Interaction. Product containing multivalent cations such as aluminum or magnesium containing antacid and product containing calcium, iron, or zinc invariably result in marked reduction of oral absorption of fluoroquinolones. Other drugs that interact with fluoroquinolones include sucralfate, probenecid, cimetidine, theophylline, warfarin, antiviral agent, phenytoin, cyclosporin, rifampin, pyrazinamide, and siloserine. Administration of quinolone antibiotic to a benzodiazepine-dependent individual can precipitate acute benzodiazepine withdrawal syndrome due to quinolone displacing benzodiazepine from their binding sites. Fluoroquinolones have varying specificity for cytochrome P450, so may have interaction with drugs cleared by those enzymes. The other from most P450 inhibitory to less is enoxaparin, ciprofloxacin, norfloxacin, ofloxacin, levofloxacin, tropofloxacin, gatifloxacin, and moxifloxacin. The generation of quinolone antibiotics. The first generation is rarely used. Frequently prescribed drugs are Avolux, moxifloxacin, ciprofloxacin, levaquin, or levofloxacin, and to some extent their generic equivalents. First generation is fluomoquin, azelinic acid, rosacin. Structurally related first generation drug, but formally not for quinolones, include sinosacin, nalidixic acid, and bromidic acid, pipimidic acid. Second generation. The second generation class is sometimes subdivided into class 1 and class 2, is ciprofloxacin, fluoroxacin, lomefloxacin, nadifloxacin, norfloxacin, ofloxacin, pefloxacin, rofloxacin. A structurally related second generation drug, but formally not a for quinolones, is enoxaparin. Third generation. Unlike the first and second generation, the third generation is active against streptococci. Is balofloxacin, grepafloxacin, levofloxacin, pazufloxacin, sparfloxacin, and temafloxacin. A structurally related third-generation drug, but formally not a for quinolone, is tosufloxacin. Fourth generation. Fourth generation quinolones act at DNA glycase and topoisomerase 4. This dual action slow development of resistance. Is clinofloxacin, gatifloxacin, moxifloxacin, sitafloxacin, proflifloxacin, basifloxacin, and delafloxacin. Two structural related third-generation drugs, but formally not for quinolones, are gemifloxacin and tropofloxacin. In development is azenosacin.